This project shows that stroke risk is high even early in life. We were able to use all of the data in the Global Burden of Disease study to show that 1 in 4 adults on average around the world are at risk of having a stroke or dying from a stroke at some point in their life. In this study, we were able to show that the risk of stroke across your whole lifetime is actually quite high even early in life. And using the results of the Global Burden of Disease study, we could show that for every country in the world, there's a certain amount of risk of stroke, even amongst people in their late 20s and early 30s, and that those risks are really quite stable until they get into their late adult years, when strokes actually start occurring. We know that the risks that drive stroke are things that take many decades to try and change. And so we want to focus people on that early life risk so they can start adopting those healthy behaviors when they'll really make a big impact. We thought this study was a really important one to pursue because we wanted to help people understand that risk is something that extends throughout their entire lives. Traditionally, people have focused on older individuals who have strokes and the kinds of things that those older adults can do either just before their stroke or immediately following it. But we know that if you can adopt a healthy lifestyle early in life, it has profound effects and you can actually avoid strokes altogether. One of the important things about this study is that we were able to estimate the risk of stroke throughout people's entire lives in every country in the world. So there have been some studies in the past where researchers have looked in particular communities at the risk of stroke. And doctors will often talk with patients and try and help them understand their risk over 1 year, 5 years, or even 10 years. But it's quite rare for us to help patients try and look across that really broad length of time far into the future for a lot of younger people. And so in this study, we were able to use the results of the Global Burden of Disease project to estimate the risk of stroke across the whole life course. And we were able to do that in every single country. We were really impressed with the phenomenally high risk of stroke, even early in life, amongst people in countries like Latvia and China. In fact, across East Asia, Eastern Europe and Central Europe, we see profoundly higher risks of stroke. And even if those strokes aren't happening until later in life, people early in life need to start thinking about what they can do to keep themselves healthy. There are particularly important risks in those locations, like high blood pressure and really high levels of unsafe use of alcohol, high cholesterol, and tobacco smoking. We know that if people can avoid those risks, then they can dramatically reduce their risk of having a stroke later in life. Strokes are so common, and we need people to understand that the kinds of changes they need to adopt have to happen much earlier than at that older adult time period when the health events actually are occurring. And so we can use these results to show people that that risk, 1 in 3, 1 in 4, 1 in 5 people having a stroke later in life, can help them really understand how to prioritize what they need to do earlier in life. And that means adopting a healthy diet, avoiding high blood pressure and high cholesterol, keeping a healthy weight throughout their life, and avoiding diabetes. There are many things people can do to try and achieve those important health goals, even without a doctor. And so we're trying to help policymakers, governments, healthcare systems, and individuals understand that they can take ownership and really make a big difference for their health, even if the things they're trying to avoid aren't going to happen for many decades. By calculating lifetime risk for a population, we can help governments and policymakers, healthcare systems, and communities understand that these risks really need to be addressed much earlier in life, that we know that things people do in their lives when they're in their 20s, 30s, and 40s are going to have these long-term downstream effects and really have a big impact on whether they stay healthy when they're older adults or whether they're at increased risk for vascular events like stroke. And so we really want people who are in a position to change their health to understand there's a lot they can do and they should start early. One of the important things that we hope comes from this project is that this is a new way of measuring risk of disease in populations, that we can track both your risk of dying of a particular disease as well as having that disease and surviving. And we want to combine these into what we call a summary measure, so that there's essentially a benchmark or a flag or a milepost that governments can use to really understand whether the choices they make and the resources they spend on health are really having the impact that they want them to have.